Damage to the brain caused by stroke can literally be measured in minutes. The faster a stroke victim gets emergency care, often the better their chances for recovery. With stroke specialists often off-site or in some cases outnumbered by stroke patients, Telerobot technology is allowing some of the most important and individualized care possible, even if it's from miles away.
Stroke is a condition that affects 750 to 800,000 Americans every year. It's a devastating disease that causes disability and is actually the #1 cause of disability. It is a disease that's caused by damage to the brain that happens when there's a lack of oxygen to a part of the brain. That can be caused by either a blood clot that comes up from the heart, or can be caused by a blood vessel that becomes blocked for another reason. You go from walking and talking and now all of a sudden you can't move your right arm and you can't say words clearly. That may or may not be a stroke, but until proven otherwise, that is a stroke and needs to be treated emergently. In that situation, time is extremely critical. The saying that we go by is that time is brain. Everything is on a clock, from the moment that the person felt normal up until a certain period of time. As time goes by, brain cells are lost forever in a stroke situation. The minute something is wrong with your body, you feel that something's changed, that time has started and you need to get to a stroke center as soon as possible by calling 911. 1 minute has been published to be equal to 2 million brain cells lost in a stroke situation. 20 minutes would be 40 million brain cells that would be devastated and would not be something that you could get back, which obviously is a tremendous amount of function, memory, the ability to walk. Today we certainly have a technology that can help us jump into a patient's room much quicker than before. It's a technology that allows me as a stroke doctor to be miles and miles away and to use an iPad to log into this machine and be able to see the patient through this machine, be able to talk to the patient, be able to examine the patient and make a quick decision about what the best treatment options are at that point in time. There are situations where stroke patients are arriving in groups. More than one patient may be having a stroke in Phoenix at one time. And on occasion, the patients will arrive within just minutes of each other at different hospitals. As a stroke specialist, it would be physically impossible to split myself into two and send myself to both of those hospitals. But with this, having 2 robots at 2 different hospitals, I am able to jump between hospital and hospital at the hit of a button. The more that's done up front with the stroke and the earlier that it's treated and addressed, the better that road to recovery at the end is for patients.
Now let's head into our next story.